Welcome to Community Rooted Approaches for Climate Change Equity. My name is Merlene Tucker, and I'll be running this Dialogue for Health web forum alongside my colleague Jeff Bornstein. Thank you to our partner for today's event, the Public Health Institute. Now it's my pleasure to introduce the moderator of today's event, Melissa Stafford Jones. Melissa is the president and CEO of the Public Health Institute. Welcome, Melissa.
Thank you, Marlene. Welcome, everyone, and thank you so much for joining us today. And thank you especially to our panelists, who I'm so looking forward to hearing from and to our discussion. 2024 marks PHI's 60th anniversary. As part of our year-long celebration of that milestone, we've been focusing on issues that we know are important to the next chapter of public health. Today's webinar marks two of those topics: the necessity of centering community voices, expertise, and leadership in creating solutions for issues that impact them, and the crisis of climate change and the critical need to prepare, prevent, adapt, and mitigate those impacts. We know that the effects of climate change affect everyone, but particularly historically marginalized communities, including migrants, outdoor workers, tribal communities, and elder and disabled community members. And yet solutions for adaptation and mitigation often don't incorporate community input or leadership, particularly from those voices. I'm so delighted to be joined by community leaders and public health partners today who are going to lead us in a discussion of how community engaged and community co-designed initiatives have led to workable, sustainable solutions for addressing heat, drought, and other climate events. We'll hear from the panelists first about their work and then have a deeper discussion together. If we could go to the next slide, please. Our first speaker is Jan Garrett. Jan serves as the Deputy Director of ADA Programs for the Pacific ADA Center at the Public Health Institute. She has over 25 years of experience providing guidance and training on the ADA and other disability rights laws for businesses, state and local governments, architects, people with disabilities, and others. As a person with lived experience of a disability, Jan has deeply personal understanding of why disability civil rights are so important. Jan, I'll turn it over to you.
Thank you so much, Melissa, and I'm pleased to be invited today. So I am, again, Jan Garrett, and I do have a mobility disability. I was born missing all four of my limbs, and I use a power wheelchair for mobility. So that is my disability. And I have been involved in disability rights and particularly the ADA for a number of years. As part of the Pacific ADA Center, we are one of the members of the ADA National Network, which is a network of 10 regional ADA centers across the country. All of us provide technical assistance in the form of informal guidance on the phone and by email on the ADA and other disability rights laws. We also provide training, and I do quite a lot of training. And if you go to our website at adapacific.org, you will find a way to sign up for our email list and also to ask us about any training that you might desire. So the Pacific ADA Center has been known among our colleagues in the ADA National Network for our work on emergency preparedness and management. So we did a series of webinars on emergency preparedness and management and the ADA over the course of several years. And those webinars are actually, the archives are on our YouTube page that people can peruse. We also did a really important project with the state of California called Listos. And that is a project where people who are particularly marginalized or speak different languages can learn more about disability and about emergency preparedness and emergency management. So we did put together the Listos project and completed that. Part of that is we have a 5 steps to preparedness document that we have prepared that will allow people, particularly with disabilities, to prepare for any kind of emergency or disaster and have formulate a plan. And the Listos 5 steps is in multiple languages, not just Spanish and English. So contact us if you want for more information on the Listos 5 steps plan. And we also have done some work with PHI and PHI's projects about climate change and emergency preparedness and how that is affecting other people. We worked on the group that is now going to be working with the Center for Disease Control and PHI and UCSF, I believe, to actually look at climate change and how it affects multi-marginalized communities. And so we did give input into that process as well on behalf of the disability and senior communities. So we are pleased to be involved here. We have lots of knowledge, lots of contacts in both the disability community and the emergency preparedness and management community, including California Office of Emergency Services, in which we have a current project where we are surveying buildings to make sure that they are accessible for potential emergency shelters. So anything that you might want to know about disability, emergency preparedness, and management, we encourage you to contact us, and we would be happy to provide what information and contacts that we have. So I will, with that, turn it back over to Melissa.
Thank you so much, Jan. I really appreciate that overview of the work, and we'll look forward to our discussion in a bit. Next, please join me in welcoming Nayamin Martinez, MPH, the director of the Central California Environmental Justice Network. Prior to joining CCEJN, Nayamin worked for the Madera County Public Health Department as a health education coordinator, a program manager with the Alliance for California Traditional Arts, and for 10 years was the health projects coordinator for the Binational Center for the Development of the Oaxacan Indigenous Communities. Nayamina has vast experience working with immigrants and residents of disadvantaged communities across the San Joaquin Valley, managing public health programs, conducting participatory research, and launching leadership and civic engagement programs. Nayamina, I will turn it over to you. Thank you so much for being here.
Thank you, Melissa, for that introduction, and thank you for the invitation. It is my pleasure to share the work that we have done on climate change, and especially about a program that we did in partnership with the Public Health Institute. Can we have the slides up, please? Next slide. So before I start with the project, which is FRESSCA for short, I want to say a few words about CCJN. So it's the Central California Environmental Justice Network. It was founded in 2000, and since then we have been fighting to end environmental racism and achieve economic justice in the Central Valley. How do we do this? Next slide, please. Is why we do this. We are the ground zero in the Central Valley for multiple sources of pollution from all these sources that you see here in the slide. Oil and gas, agriculture, dairies, warehouses. So all of those things, as you know, all the emissions are exacerbating climate change, and that's why our work is so relevant. Next slide, please. So the work that we do is multi-pronged approach. We educate, we also advocate for solutions, we empower residents to go and try to change the dynamics in their communities that are not conducive to their health, and we network. And we network with institutions like PHI and others to resolve these issues that we find in communities. Next slide, please. So the main thing that I want to point out is how do we identify the community needs and therefore the programs in which we focus. I will say that we are always in communication with the community members, and this particular project is a perfect example of how our projects are rooted in the most prioritized needs of the communities. So the FRESSCA project was born because in 2000, we were doing a community meeting educating people about air pollution. The Central Valley has the worst air quality in the nation. And someone raised her hand and say, oh, what do? I have a swamp cooler. I'm like, okay, I'll get back to you. because we were talking about how you need to replace your air filters. They don't have that. So that prompted, and that the situation that happened in 2020 and 2021 is also that we have massive wildfires in the middle of the summer. So the evaporative coolers, or swamp coolers, are used to cool their houses. But when you have those devices, they bring all the air from the outside into the house. So people were breathing wildfire smoke inside their homes as well as outside. Next slide, please. So why is it so dangerous? As we know, there's a significant increased exposure by outdoor workers, including the agricultural workers, but also, as I said, the smoke coming into the houses through the swamp coolers. Next slide. And that's when we came together. And it was at that time that we worked with different people within PHI, the Trucking California Project, Dr. Gina Solomon, and we were able to assemble a multidisciplinary group of researchers that were responding to farm worker needs through 3 different things. Designing a filter for the evaporative coolers that was effective, easy to install, and affordable, that we tested this intervention in the San Joaquin Valley, and then engaged residents to understand potential barriers for widespread use of these filters. And I'm not going to go over all the details, next slide please, of the project, but I just want to highlight that we pilot this project in 3 communities, Kern, Fresno, and Kings County. These were all rural communities and we selected farm workers for this project. Next slide, please. So these were the study participants, Hispanic women. They had lived at least 5 years in their home. Many were homeowners, and the majority were, all of them either working as farm workers or in packing houses. And most of them had a medical, or others were uninsured. Next slide, please. This is how the piloting of the intervention looked like in the different homes that we were part of our study. Next slide. And these are just some updates of the report. So the FRESSCA Mujeres implemented this filtration solution for external installation on 25 homes with evaporative coolers and air cleaners in 48 homes. The researchers did extensive assessment of the effectiveness of the intervention by measuring with a monitor the air quality inside the house and outside the house. And there was also biosamples that were collected, urine samples that were given by the project participants. Next slide. Just to conclude, I just want to say that the preliminary results have determined that families and the data analysis of the air monitoring data tell us that there was a 50% decrease in particle pollution after the installation of the filtration system. So that's very significant. The farm worker leaders not only wanted to say, wow, this works, and we want this to be replicated in other homes with evaporative coolers, they also wanted to tell their stories. And this is very relevant to the discussion that we're going to have in a minute, where I think it is important to hear those stories because they can inspire projects like these, where researchers and community members are working together to find solutions to the needs that underserved communities are facing and are exacerbated by climate change. So this is my last slide, and I'm happy to engage in the conversation after the other panelists present.
Thank you so much, Nayamin. I want to really encourage people to go watch those videos. They are very powerful stories of this work, and I really appreciated them. They are really amazing stories from people involved directly in the work. So thank you, Nayamin. Our last speaker is Sarah Ryan, Environmental Director and Emergency Management Director in the Environmental Protection Department, the Big Valley Band of Pomo Indians. Sarah has worked with the Big Valley Band of Pomo Indians since 2001, focusing on tribal data integration, water quality, and pollution management. She co-developed the Clear Lake Cyanotoxin Monitoring Program and co-chairs the California Cyanobacterial Harmful Algal Bloom Network. Sarah collaborates with federal, state, and tribal agencies to advance water policies, secures environmental grants, and leads initiatives to protect California Clear Lake's ecosystem, including stormwater management, habitat restoration, and accessible water quality data. Welcome, Sarah.
Thank you. Good morning. I'm going to go ahead and share my screen. There we go. Good morning, everyone. I'm here today to talk a little bit about our CHARM program that we've done in partnership with the Public Health Institute and Tracking California. But as the introduction just said, there's a whole lot that we do at Big Valley Band of Pomo Indians, working with other tribes and agencies to protect natural resources so that tribal members can be using the water, the birds, all of the food sources and medicines in the ways that they traditionally have, and not get sick. And when you have a lot of pollution, when you don't even know the full level, the full burden of contaminants, then it's hard to to say that you can safely use these things. So with this CHARM program, the Big Valley Band of Pomo Indians helped develop this work plan to look at how harmful algal blooms and also extreme heat events are affecting the whole community, not just the tribal community, but everyone within Lake County who are our neighbors. As was mentioned, with the previous presentations, we're all looking at ways to mitigate for climate change because they are impacting the health of the people and the natural resources in ways that we haven't seen before. So Charm Lake County is a project that was developed, stands for Climate Health Adaptation and Resilience Mobilization. And it is a project that was developed to look at how prepared we were as a community, not just the tribal community, but the other neighbors within Lake County. And Lake County is, and I'm going to go ahead and switch over to the actual website. Apologies. So Lake County is located on the shores of Clear Lake, which is the largest natural lake in California. It has over 100 miles of shoreline. There's a dormant volcano, Mount Canocti, about 65,000 people. And there's other watersheds within Lake County and areas that are not alongside the lake, but we're all looking at extreme heat and other climate change impacts that are affecting all of us. What we were really curious about is how prepared are we as a community? So the CHARM project is actually a 2-year project. We've now we've been informed that there's a little bit more funding that is going to be coming down the pike for the next number of years. But we wanted to create an action plan in this CHARM program to develop how we were going to be working together collaboratively with the data that we have. One of the things that we noticed was that we needed to pull together a working group of people who who would be able to represent their communities. So as you can see in this working group list, there's a number of tribes that are in there. There's some NGOs that are in there. There are local government that's in there. And we have been meeting regularly to not only look at what sort of resilience plans do we have for extreme heat, but also how can we be even more prepared. The one thing that we noticed with the data that's been collected with this project is that Lake County is actually in pretty bad shape in terms of of how the extreme heat could be affecting our most vulnerable populations. We have identified that we have a number of unhoused folks, we have outdoor workers, we have a number of community members, both within the tribes and outside of the tribes, who are living in homes that don't even have electricity. And as the temperature goes up over, this last century, we know that we also have some illnesses and heat exacerbated health that is not acceptable. We want to make sure that the most vulnerable of our communities are not impacted or even lose their lives because of extreme heat. We also noticed that there's in Lake County that heat-related illnesses are actually twice the state average. So as we started to pull information together, we noticed that many of us did not have plans that were actually to how to address heat and harmful algal blooms with our most vulnerable community. So we've had, since the project started, we've had a tabletop exercise that helped do basically an emergency response to extreme heat and harmful algal blooms. And we also looked at how we could work together. So our website has been there's a lot of great information on here. We have done a lot of surveys with community members and vulnerable groups and interviews, and it's really helped us prepare for this next stage, which is how to work with trusted community organizations for our vulnerable populations to be able to come up with some activities and mitigation measures that will um, lessen the impacts of extreme heat and harmful algal blooms. I didn't say much about harmful algal blooms, but we do have some danger levels of toxins in Clear Lake, which does impact drinking water and impacts the ability to go cool off on the hot days. And when you're talking about unhoused populations or even people who use the lake very regularly, it's quite the impact. So just a little snippet about the Charm project. We're looking forward to continuing to work with the local community to be able to address climate change impacts, particularly extreme heat and harmful algal blooms. Thank you.
Thank you so much to our panelists for those terrific overviews. And I know they were very short overviews of very in-depth work of just really incredible work and projects and programs addressing climate mitigation and resilience and prevention of health impacts. And really highlighting the partnership, the deep partnership and engagement with community directly in the work. So we're going to go a bit deeper now into the work and have some question and answer. I have a few questions. Really also want to encourage folks that are part of the webinar to put their questions in the chat, and then the team will help lift those up so they can be a part of the discussion as well. So if we can see our panelists as well, wonderful. I'm going to start with a question, and we'll open it up, and maybe we'll start with the first question, just going in the same order that we went with the presentation, starting with Jan, then Nayamin, and Sarah. And the first question I wanted to really raise with you all for folks to hear is, can you help give some examples of the perspectives, the unique perspectives, the experience, the leadership, or the guidance and direction that the community itself offered as part of this work, that if community had not been centered and deeply engaged from the very start, that might have been missed and might have really meant the work was not as impactful? Jan, would you like to start?
Well, I think I understand the question. So the bottom line with the disability community and also older adults with emergencies and disasters and climate change in general is that, they are impacted often more than other people. Certainly, we know that people with disabilities and older adults and others living in poverty who can't escape during fires and other disasters lose their lives at much higher rates. They also have difficulties because of their disabilities with extreme heat, with air pollution, with, all the different areas of climate change. So we know that our work in terms of talking to people about emergency preparedness and disability awareness and ADA is extremely important in telling also the emergency managers and other communities that they really need to address these concerns, not just simply as an afterthought, but as part of the actual planning that they do. And we encourage all nonprofits that are doing planning to invite, disability community representatives as well, to make sure that our voice is at the table.
Mhm. And that the plan, it sounds like, then has really specific concrete steps and approaches that address different issues that emerge through that dialogue.
Yes, absolutely. And that it's not just kind of, oh, well, people with disabilities will ultimately be addressed by the police and firefighters, the first responders, which we know will not happen because they're going to be very, very busy during a disaster. And then there's lots of other, like we talked about, high heat and high pollution, where there are no first responders going door to door for people, but they are impacting our communities of people with disabilities and older adults.
Thank you, Jan. Nayamin.
I completely agree with Jan that there has to be more opportunities to co-participation to develop these plans, and that goes to the communities that we serve, which is our farm workers. I think it was very easy to assess that, yes, if you're working outdoors as an agricultural worker is, or a construction worker, a landscaper, it's a no-brainer that they're more exposed to this wildfire or heat or all these effects. However, who would have known, not even me, honestly, about the issue of a home with a swamp cooler? And a lot of these people making sometimes decisions in Sacramento or elsewhere have not that lived experience. So without having at the forefront center these community priority populations, without knowing really what are their needs and how we can help them, we're going to be inventing programs that are not going to have a good fit, that are not going to be usable, and that are not going to hit the mark. So I think that is so important to, whenever researchers, whenever a government, whenever anyone, including ourselves, want to understand how we can help people, let's ask people first, right? They are the ones who know what the problems are, and oftentimes the solutions that they would like and will be more beneficial. So I cannot stress enough that it doesn't take a lot. We're right now doing a series of focus groups with farm workers to understand climate change effects, not only through wildfires, but other things. And we have gathered so much information that we're going to be publishing next year, because we hope that that is what inspires all kinds of stakeholders to act upon. Thank you.
Thank you, Nayamin. Sarah, is there something you'd like to add?
Yes, the program itself, the project itself was conceived by the tribe and Tracking California, because we knew that within the tribal communities, there were a number of homes where you really couldn't regulate the extreme heat. And knowing that we needed some additional planning and just resilience building, we thought that it would be great to be focused on that. Harmful algal blooms was a no-brainer because we know we have toxins here and it's impacting lots of uses of that water. So what was interesting about this project is that in the larger scheme of things within the county, and their own emergency response, basically hazard mitigation plans, the county had previously identified extreme heat as a low priority um, um, disaster, that there was not a lot of risk for it. It was not seen as a big vulnerability for the county. And so the tribal, really this project, coming from the tribe itself, was able to identify that actually there are a number of people who are being impacted, not just tribal folks, when extreme heat happens. So I think that there is a huge value to community-based projects because sometimes things aren't noticed, until people bring it up, just as Nayamin was saying, that it ends up being a really important to get that viewpoint, because people are not necessarily speaking up about it, or maybe the local governments aren't really picking up on it. But regardless, it's still what we were able to determine, just from starting this project, was that the with extreme heat being, Lake County residents being impacted at a 2 times higher than the state average. I mean, that shows you right there that it actually should have been prioritized a lot higher. So I think we were able to open some eyes at the local level, and also start to get to work on it, so that the most vulnerable communities are not going to be as impacted as they have been. So, and if we hadn't have done this project, I don't think it would have come up.
Thank you, Sarah. All of you in that highlighted, I think, a really clearly and powerfully an important piece, which is, I think sometimes in our different projects and programs, people think about engaging the community after it's created. And what you are all really lifting up is the identification of whether it's an issue, a problem, an opportunity, a need, needs to start with community, and then you scope and shape sort of the project from that. And I think we so often collectively, the way, whether it's in government or nonprofits, it's a second or third step, and you're really lifting up, in some ways it's like a pre-step, even that deep community engagement. So I really hear you, and want all of us today to sort of take that away in terms of the whole trajectory of the centrality of partnering with community. Can we go to the other end maybe of the process though? And I think it might be really helpful for all of us to hear on the webinar about when you have done that work of really deeply and thoughtfully engaging community from the very beginning of sort of the need or the problem identification through the whole process. How, in your experience, has that actually changed the outcomes? How has it made the outcome better or stronger or more sustainable? Are there some examples you could share with the audience around that? Nayamin, do you want to start this time?
Sure. Well, I think what I had tried to always do when I work with these diverse stakeholders is for the engagement to be through the entire process. Because yes, the ideas oftentimes come from the community. Well, the need. Okay, I'm choking with smoke inside my house, but I don't know what to do. I didn't know neither. So all the expertise. But then as the filters, for example, were tested, we encountered so many obstacles. Oh, well, this thing, it's not practical because of that. So it was functioning well in the lab when they were running the analysis. So that is my example of why it's so important to continue the interaction throughout the project development, the planning, the design, the implementation, and then the evaluation. Because again, things can be perfect in a lab, in a very controlled environment, but we don't have that, we didn't even know there was an alert of storms in the middle of the summer when the filters were there, and we're rushing to try to take them down because we were not expecting that. So I think, and one way in which we did it is, we know that the participants were going to be busy, working. There are farm workers. So we established an advisory group that was like a sample of the same type of community participants, right? So they were farm workers themselves. They had swamp colors in their homes. So they were a great proxy for us to keep on engaging them throughout the project. Are the materials that we're using to share back the preliminary results in community meetings, are they relevant? Are they understandable? For sensitive topics, how do we go about telling people? Unfortunately, through the biosamples that we collected, we didn't only get data about air pollution. We find high levels of mercury among farm workers. And they're like, okay, what are we going to do? How are we going to not only say, oh, by the way, you have high levels of mercury? That's not what we do. We need to be resourceful. We need to provide resources, right? So I think that for me is the importance of having this engagement throughout the entire process. And then in the evaluation piece, because we might have metrics, like, oh, all this data from the lab is here, but the live experiences, how they are feeling that, now that I have not only this filter, but this information have changed my life, that now I'm more knowledgeable. Now I watching out about, when my kids are outside playing and the air pollution is bad, how are probably more engaged in decision making, like there was in the valley in the middle of the summer. We have the discussion where they approved the state implementation plan for PM 2.5. So a lot of our project participants participate, telling, excuse me, you cannot be approving this plan because look where we are. I'm choking, my son has asthma. So I think if we were not engaging the residents in collecting all these unexpected impacts, we will miss it. So for me, it's extremely important. The engagement is throughout.
Thank you, Nayamin. Very powerful example. Sarah, is there a way you would maybe want to help the audience understand how you have seen a true co-design process result in different outcomes than might have otherwise occurred?
Well, I think I referred to it a bit in my earlier answer, which is that when this project started, and the even the topics of extreme heat and harmful algal blooms really were identified by originally by the tribe to say, we know we're having impacts on these because of these two climate related activities and or impacts, and we're assuming that others within the community are and being able to work with Tracking California to identify some important steps of communicating with local tribes, with other vulnerable populations such as outdoor workers, unhoused, the other communities, senior communities, and others within Lake County, that we were able to pick a couple topics that we knew we had a little bit of data on, or a lot of data in terms of HABs, and to really hone it into what can we do. We've got some homes here, tribal homes within some of the tribal communities. There are 7 federally recognized tribes here in Lake County. So we know that there are some homes on the tribal lands where there's no electricity. And so, or they're using, there is electricity, but there's no central heating and air, and you're having to spend a lot of money to keep your place cool or hot. Um, Depending on the weather. And so, we wanted to have something that was, particularly focused here, that we knew was an issue. And like I said earlier, I don't, and now that it's become this broader project where we're collaborating and networking with the NGOs and local governments, and really trying to define these next steps so that, during the next heat events, extreme heat events, that we have fewer people going to the hospital, fewer people who are having to be basically rescued from their homes. We know that we're doing good. We're doing good because there are prior to this project, what the resource that was offered to local community was go to the library, um, which is only open 9 to 5 Monday through Friday, and and earlier on Saturday. And it's just, it's not, how do people get there if they don't have vehicles, or they don't have the funds to? And then secondly, they were told, yeah, go to the grocery store, go to Walmart, go to the library. That's how you can cool off for extreme heat events. Buy bottled water. There's not even a local public swimming pool in the county, so people can't, go cool off somewhere or really take care of themselves. And so those solutions were the best that that local government could come up with at the time. We've been able to, with our project, and development of this project, is to really unpack and dive into and screw into what what the big issues are here. People aren't being communicated with. We don't really know the full extent of their suffering. We don't know the full extent of the dysfunction of the resources around them. So I really think, without this project, and the co-development of it with local community, we just wouldn't have this information. We wouldn't be able to act on this information because we wouldn't have it.
Thank you, Sarah. Yeah, knowing what's actually going to work, to your point, versus sort of theoretical solutions versus what's actually going to have impact. Jan, is there an example you might want to share in that in terms of what really works that you can only know through engaging the community and change the outcomes?
Sure. Well, we have done some research actually with a researcher where we contacted emergency managers across our region and people with disabilities and ADA coordinators, people who work in these local governments who are supposed to be responsible for enforcing the Americans with Disabilities Act and making sure that these cities and counties are complying with it. And we asked, do you know about how emergencies affect people with disabilities? Do you know you can contact your ADA coordinator if it's the emergency manager that we're asking? Very, very few of them even knew there was an ADA coordinator in their city or county that may know and be connected to the disability community. Very few of the ADA coordinators were responding that they were able to work with their emergency management department. So there's a real disconnect there, and we are trying to use that research to bring together the disability community, ADA coordinator community, and emergency managers to be able to say, everybody needs to be talking to each other at the table because, even among the groups that we have here today, farm workers, tribal members, they are have higher levels of disability than even, other groups generally across the board. So we need to make sure that the disability community and the older adult community, which is intersectional, has all the different identities, is at the table communicating and that that our needs are being met. And I feel like we need to start convening some roundtables, some groups to really have that, be more effective. And I'd love to work with Nayamin and Sarah and others on your work in terms of making sure that we're all talking together and we're all using our power of our different groups to come together and make sure that our leaders are hearing us and in terms of what needs to be done.
Thank you, Jan. I love that we're building collaboration right in the middle of the webinar for this work. We've talked some about the what in terms of the criticality of ongoing deep not just community engagement, but really community participation and decision making. We talked about why it matters in terms of the outcomes and how it changes the work itself, including identifying even what the key issues are. I'm wondering if you could each talk a little bit about the how, and maybe we can start with you, Sarah, but is there something you can share with the group participating today around sort of the how of what really sort of meaningful community participation looks like? How do you approach it? What do maybe different organizations or agencies that maybe are used to doing surveys or other things that are important steps to engaging the community, but really want to sort of go up the community engagement ladder, for those of us who are sort of familiar with that model, into a greater engagement, participation, even co-design and co-decision making? How do you go about doing that? How do you make that more meaningful? What does that need to look like for people who maybe really want to deepen their work in this space of partnering with community? Sarah, would you like to start?
Sure. I'm thinking there's sort of two tracks to be able to answer that. One is the community of responders. And so, we put together a working group, as I mentioned, of tribes, local government, NGOs. But then we reached into the contacts, and within these working groups to talk to work with them directly with their communities that they serve. And so the other community engagement is actually interviewing and speaking with and meeting with the community that's actually being served. And so to be able to interview people living in transitional housing, for example, I got to do a few of those interviews, and it was very, very helpful and interesting and eye-opening. The what that particular community member had to go through, uh, uh, during a heat wave. For example, they're like, we take buses around to get, from place to place, and there's not even any shade structures at the bus stops. You know, there's no drinking water fountains. And there's no, how about getting some ice? Things that maybe, to have that reaching in and actually having, not just the community-based organizations, but members themselves who are actually being impacted. I just found that those surveys and interviews, and which of course we paid them for their time, because that was they took the time to meet with us and also share their experiences and their ideas. So that's where these ideas of shade structures and cooling areas and ice places to pass out ice, because you could pass out bottles of water all day long, but if it's warm bottles of water, that's not so helpful in a heat wave. Um, and besides, these have probably been sitting in the back of someone's car for like 6 days, and it probably tastes like plastic now, and who knows what else is in it. So to actually to get these ideas from people who are being impacted, it's a no-brainer. I mean, we need to be reaching out like that. Otherwise, we're not going to, to the extent that we're all sort of sheltered from those real life experiences, we'll never quite get them unless we talk to the community members themselves. So working with the NGOs and the responding entities, but also the people themselves, and both of those have been incredibly helpful. And I'm really grateful that they're both components of our program.
Thank you, Sarah. We're going to turn to some Q&A from our webinar participants in just a minute, but Jan or Nayamin, if there was something specific you wanted to add about this how to really meaningfully engage community, we'd love to hear that.
I agree with Sarah. I think definitely you have to have the opportunity of talking to the people. And the first thing that I would do is to identify the preferred modes of communication of your target population. So definitely going through the trusted partners as CBOs, local CBOs is super important. But even, like, okay, do people prefer to have a verbal communication? Like with our farm workers, we cannot do surveys. They're not going to respond it. So we have to go, and yes, I was saying before, we are doing this focus group. We call it listening sessions, whatever you want to call them. But the fact is that it's in-person interaction, because verbal communication for people who have low literacy in terms of using the computer, or even having limited access to internet, and not like even not having a smartphone. So if you feel that, your survey monkey is going to cut it off, no. If you think that, for example, like our county did when they were trying to run a measure for transportation, sale tax, and they sent a survey. They also did some meetings in cities. So residents that do not have public transportation in the rural areas were not even consulted. So was that reflective of the needs of community? Obviously not. So we have to think about who are we trying to target and what is the best way to go about it. So that includes meeting in person.
Thank you, Nayamin. Go ahead, Jan.
Can I just say, and I agree, and for the disability community, it does mean making sure that you have accessible sites to meet in person. Meeting in person is really good. Having early afternoon meetings, because a lot of people have attendants that have to get them up in the morning. So don't meet in the early morning for people, or meet in the evenings when people are not working and have availability. Have some kind of transportation that gets people to where they need to go, if at all possible. Also making sure that you're reaching people who are deaf and hard of hearing. Do you need captioning? Do you need sign language interpreters at your meetings? Making sure that you're reaching the entire community, because if you're not communicating with everyone, then you're not hearing from everyone and you're not understanding what everyone is facing. So making sure the communication accessibility is there, the physical accessibility is there, the variety of locations to meet is there, the transportation is there when you can, and all of those things are incredibly important. Yeah, because not everybody has access to the internet or computers. You know, a lot of people with disabilities do, but a lot don't either, that are living in poverty. So it's important that you try to reach everyone, and particularly the people who are most marginalized.
Thank you, Jan. I want to lift up two interrelated questions in the Q&A that I think from the audience that I think some of you already touched on. But one question was, what was the process of building trust with communities? And I think you each shared some examples of the way you did that. But if there's anything you wanted to add to that, please do. But there was also a related question, I think, which is, we know these are also sometimes sensitive or challenging or difficult topics. And I mean, you mentioned like finding mercury, right, in blood sample, like what's happening there. And I think there was also really a question around, when those issues arise, how have you engaged with community to talk about sort of sensitive, challenging health issues and health effects in a way that has really worked in partnership with community? Is there somebody who'd like to talk about either trust or talking about sensitive health issues with community?
I can address the sensitive issues. So going back to the mercury example, you know, we first huddle among the researchers and the team and brainstorm. Okay, so we're going to identify resources, and we're going to help also identify what was the source of the mercury, and try to do like a wraparound kind of support. So it's not only giving the information, and then even thinking about what was the most appropriate way to do it. So, you know, our staff went and was there in person, delivering the results, explaining, and, you know, kind of like giving a support throughout the process, so people do not feel like we just throw a bomb at them. So I think it's taking the time to work internally with your team, but then find the resources. For example, we reach out to the Department of Public Health. They have a program, so they were able to assist us. So sometimes it's even expanding even more your team so that you can support the community in addressing these issues of well, you know, you have now this in your body. Now what's going to happen? You have a doctor? How are you going to be supported, helped?
Yeah.
Thank you, Nayamin. Go ahead, Jan.
I'm sorry, and I have to jump to another webinar that I'm doing today, unfortunately. But in terms of trust, you know, I would say making sure you're addressing what you know are the concerns of the community, and that you're, you know, hearing them, and that you're addressing those issues, and that you bring in the trusted messengers, the trusted organizations that are there every day, not just people who come in for this discussion, but the people who are there every day talking to the folks and serving them. And that's, I think, so important for people.
Thanks, Jan. I think you have all highlighted how having the agenda and priorities driven by community is so essential to the trust building process. I want to close with one last question. That's a couple of different questions in the Q&A that were around really different partners and how you engaged them, and how that related to the works. There was a question around the role and engagement of promotores or community health workers, of public health departments. You each mentioned actually sort of the role there, some examples around that, or when there was another question related to healthcare providers. You just mentioned an example of that, Nayamin, but are there other ways, and those specific partners or others in particular, that you would want to highlight those partnerships and how those came about, or why they were important or mattered?
I totally agree that you know, for instance, the promotoras, but not even the promotoras, because now that there is a training and all that, it's kind of like not everybody's a promotora, but there is always a natural leader in a community. someone that people go to ask all the questions about. So you will find that person, you find a gem, because they are going to be that bridge to be the trusted, partner within the community. So even when you don't have a network of promotores, established one that, there's several across the state, you can, just go around and identify those key informal leaders. So I think that's important, because at the end of the day, even sometimes people, if they just show up and give a flyer, you can put the logo of a research institute or the health department, but that, and they're going to be like, I don't know, is this a scam? Someone is trying to, talk me into something. There's a lot of abuse happening right now of, all kinds of companies, even, in the Valley, we have seen a lot of companies trying to come and say, oh, we're going to put this project. And, like approaching people with very misleading intents. So that is even causing a lot of more distrust in communities. So I think working with the community leaders is very important.
Thank you, Nayamin. Sarah, is there something you'd like to add?
Yes, I'm so glad Naimeen said community leaders. And I think that's how we've been able to get as far as we have with this project, because it really is it's the groups around the county, including local governments, who do serve members, have people who they assist and connect up with resources. And when it comes to, working with the trusted, groups. We went to, for example, a location where a lot of people go for resources if they are unhoused, and and they go, it's a comfortable place. It's actually a county run location, community group. And this is a place where people go and they get information and they hang out, and get, eat and, and just and get some support and connection to other resources. And so those are the types of groups that we've identified as like trusted partners, because that's where people prefer to go. They're not going to go to a shelter necessarily. They're not going to go to some of these to Red Cross or something. They are going to these local community hubs, basically, to get their information and to get some assistance. And so those are the folks that we want to work with, to make sure that the vulnerable population gets, that we are able to connect with them. So it's really led by who do these community members go to for their, support and connection. And so that's how, it's almost looking at it from the other way. But those are also the ones that we've invited to be on our working group. So yeah, again, just, using the a community center and a community led model, and hopefully we'll come up with a lot of great things that really help people.
Thank you, Sarah. I want to thank Sarah, Nayamin, and Jan for presenting today and sharing the work that you are doing, and all of the participants on today's webinar. Just really powerful examples of how deep community partnership, from, as we talked about, the very beginning steps of even identifying what the issues are that need to be addressed, all the way through to the solutions, and making sure that those solutions are things that can be implemented and therefore have real meaningful outcomes, is so critical in the way that it must be driven through trust and through starting with community. Engaging the community from the very beginning is so powerful. And you gave us all a lot to learn from and think about. So thank you for sharing the work and the ongoing work that you are doing. I also just want to, note and remind us all that there are so many issues, right, around that we are all working on. Today we were focused on, climate change and the impacts of that. But that at the heart of public health, at the end of the day, the core of public health, its purpose is community. We are doing this work of public health to support communities to thrive, to be healthy, to be well. And so I want to really appreciate all of our presenters, but also I bet all of the participants on this webinar who are also sharing in that work and in that effort of truly keeping community at the center of everything that we do together in public health. So thank you everyone for being here. Really appreciate your participation and attention and great questions. And I also want to wish everybody a really joyous holiday season, a chance for some rest and some restoration as we prepare for the important work we'll be doing in the year ahead. And thank you for helping PHI celebrate its 60th anniversary. Take care, everyone. Bye-bye.